It's Monday, March 1. This is the news on PBCJ. I'm Simone Absalom Gale. Minister of Health and Wellness, Dr. Christopher Tufton, says Jamaica should receive 50,000 doses of a COVID-19 vaccine approved by the World Health Organization from India next week. He shared details of this and other vaccine procurement plans at a COVID-19 press brief on Sunday.
This shipment is expected to land in Jamaica on or before Thursday of this week. I wish also to announce the provision of an additional arrival, some 14,400 doses of AstraZeneca vaccine that will be delivered to the island on or before March 11th.
Dr. Tufton says the additional doses are part of the COVAX facility.
This supply represents the first installment of a total allocation of some 124,800 doses of vaccine under the COVAX arrangement in the first instance. Remember now we had said that we would get up to 900,000 for supplies at a 2-dose per person, approximately 450,000 individuals. So in the first instance, we're to get 124,800. We will get a small amount of that, but nevertheless, we appreciate on or before the 11th of March, some 14,400. That has been signed off on, all the arrangements made. It's just the logistics now moving that from Europe.
He says 1.8 million doses of vaccines are to be supplied to Jamaica through CARICOM in April. He wants Jamaicans to get ready for inoculation.
I just want to take the opportunity again to ask Jamaicans to prepare themselves for the vaccines that are going to be available in order, according to the Prime Minister, the priorities that are contained within the plan, the vaccine plan, which was tabled in the Parliament. So this plan speaks to who will get vaccinated first: healthcare workers, government officials, and government officials meaning government opposition, councillors, local municipal cooperation, the elderly, 60 years and over, the Jamaica Defence Force, the Jamaica Constabulary Force, the Jamaica Fire Brigade, Passport, Immigration and Citizenship Agency, and persons who work in early childhood, primary and secondary education institutions.
That group consists of 450,000 individuals. The health minister says more details regarding the distribution of vaccines will be disclosed this week. Melvin Pennant, PBCJ News.
Protecting lives and livelihoods. That's the rationale from Prime Minister Andrew Holness as he announced stricter COVID-19 measures under the Disaster Risk Management Act, effective March 1. Speaking at a COVID-19 press conference on the weekend, Mr. Holness explained that the government has to move decisively to counter an increase in COVID-19 cases, deaths and hospitalizations.
The curfew hour will remain at 8 p.m. nightly to 5 a.m. the following morning until March 23rd, 2021 at 5 a.m. Zoos, parks, gyms, attractions, and bars will be closed at 6 p.m. and this will continue in effect until the 22nd of March 2021. Public gathering limit will remain at 10 persons until March 22nd, 2021.
There is a 3-week ban on funeral services.
The new measures as it relates to funeral, effective the 8th of March to the 22nd of March, funerals and burials will be prohibited. After the 8th, there will be no funeral permitted, no burials permitted until the 22nd. We have to take this drastic action because we do not see any willingness on the part of our brothers and sisters. Not everyone, some people do comply. but we are seeing a significant level of non-compliance in this area.
The Prime Minister says weddings are down to 25 participants.
Except that the cap that we had placed on weddings, which was 50, we have now halved that, so only 25 persons, including the bride, groom, who else we need? The bride, groom, pastor, and the 2 witnesses, right? Of course, you can have your best man and the maid of honor and a few others, the mother and the parents of the bride and the parents of the groom. 25 is good enough. I mean, I'm sorry to do this, but we have to do it.
As we continue our daily monitoring of the COVID-19 pandemic, here is the latest clinical management summary.
In the summary for Sunday, February 28, 336 new COVID-19 cases were reported. Of the 23,599 overall case count, 9,405 are active. Here is the parish breakdown. St. James has 111 cases. There are 83 in Kingston and St. Andrew, while St. Catherine has 54 cases. St. Anne reported 27 cases, Hanover posted 24, and both Manchester and St. Thomas recorded 8 cases. Westmoreland has 7, St. Mary has 4, while Clarendon, Portland, and Trelawney each posted 3 cases. St. Elizabeth reported 1 case. 3 deaths were reported over the period, bringing that total to 425. In the meantime, 13,502 recoveries have been reported overall, with 92 reported in the last 24 hours. Currently, 264 persons are hospitalized, with 31 patients showing moderate symptoms and 22 patients critical. For the news on PBCJ, I'm Gabrielle Thompson.
More than 400 people have died in Jamaica from complications due to COVID-19 since the start of the pandemic in 2020. Chief Medical Officer Dr. Jacqueline Mackenzie says the largest case fatality rates occurs in those persons over 60 years. The CMO gave a situation update during the latest COVID-19 press brief on Sunday.
The numbers don't lie, and the numbers are bleak. Up until Saturday, February 27, there have been 422 deaths from COVID-19 and over 23,000 cases in total. The island's Chief Medical Officer, Dr. Jacqueline Mackenzie, says there is cause for concern. Specifically, she pointed to the island's virus reproductive rate and the increased virus positivity rates.
As you can see, that our case numbers would have started going up from early January and have continued to go up, and we are still increasing. We have not plateaued as yet. So even more important why it is that we need to have some restrictions in order to prevent the case numbers from going up further. This slide speaks about the reproductive rate, and here you can see that while it is that we are not at the highest number in terms of reproductive rate, we're actually at about 1.3 compared to in the past where we have had numbers at 2 over 2. We would see that because of the number of positive cases, certainly if you have 400 positive cases and you have a reproductive rate of 1.3, it means that we expect over 400 persons, almost 600 or so, to be infected by this set of 400 persons. So because of the larger number, it is even more significant where the numbers are concerned, even though the reproductive rate is at 1.3.
Another worrying trend is that of positivity increases in all parishes. However, the CMO singled out the parishes with the highest case counts.
Here we quickly look at what's happening across the parishes, and we can see that our problem parishes still remain St. Catherine, Kingston and St. Andrew, St. James, and we've had increase in cases in Clarendon, in Manchester, and in St. Anne. So the precautions, persons in those parishes really need to pay particular attention to precautions.
There is also the issue of bed space. Increased cases are driving up hospital admissions and straining the capacity at these facilities.
This graph shows us that the number of admissions per week has been increasing. So it is not just a matter of that we have patients that are long stayers on the beds, that are occupying the beds, that are causing us to almost be at 100% positivity rate. The fact is that since December, we have seen where we had an average daily admission of about 20 to 25. Now we have a daily admission rate for COVID, suspected or confirmed cases, of between 45 to 50. So the admissions per day are in fact increasing.
These statistics bear out the stark reality of an island under siege from a silent, faceless enemy. The pandemic continues to run rampant through community transmission, even as the government tries to get a handle on the worsening scenario. For the news on PBCJ, I'm Gabrielle Thompson.
Like any virus, COVID-19 needs carriers to move. In 2020, one of the tools the government used to curtail the movement of COVID-19 was the mandate of work from home where applicable. Faced with a rising curve of COVID-19 cases, coupled with increased symptomatic persons flooding the nation's hospitals, the government has re-implemented work from home orders. This takes effect on Thursday, March 4, 2021.
And the permanent secretaries are directed to have only persons who work in critical service delivery and where the nature of the work performed requires that the job functions be performed at the physical office location. This means that for the public sector, meaning ministries, departments, and agencies, there is now a hard work from home rule. The private sector is encouraged to arrange their affairs in such a way as to facilitate their staff working from home. So we are not placing a hard and fast rule on the private sector, but we are expecting that they will follow suit and make their arrangements to allow their staff to work from home where it is possible and convenient.
The Ministry of Health and Wellness is implementing its COVID-19 surge plan. This as the country's hospitals have run out of bed space in the wards dedicated to treating COVID-19 patients. Minister of Health and Wellness, Dr. Christopher Tufton, says additional bed spaces are being created to offset the shortage. There has been a steady rise in the number of new COVID-19 cases in the last few weeks. More than 400 new cases were recorded over the last 48 hours. The Health Minister, Dr. Christopher Tufton, says the increase in COVID-19 cases have led to more hospitalizations.
We now average some 48 admissions per day across all our hospitals. Based on the epidemiological data, we're averaging an infection rate, or R0 rate, as said earlier, of 1.3, which means that every person infected with COVID-19 will infect approximately 1.3 others. If this rate is not reduced, we will continue to see a rise in infections, which will ultimately lead to an increase in the number of persons that are hospitalized.
Dr. Tufton says as at February 26, all beds currently dedicated to COVID-19 isolation are now full, and the Health Ministry's surge plan has been activated.
In implementing the plan, the following actions are being taken. St. Joseph's COVID-19 ward at St. Joseph's Hospital, this is a 36-bed facility, is now in operation with an occupancy of approximately 8 persons. As the weeks move on, we will admit more patients to this ward based, of course, on the infection rate. Falmouth Hospital COVID-19 ward, this 36-bed facility is now fully equipped. While the building is complete, the appropriate infection prevention and control measures must be completed before the building is safe, especially for patients with severe acute respiratory illness.
Dr. Tufton says the Spanish Town Hospital has added 40 beds with the use of the field hospital erected on its grounds.
And at the University Hospital of the West Indies, there's some conversion taking place from regular wards to COVID wards. The management of the UHWI has now completed the conversion of an additional ward for the admission of COVID patients, numbering some 24 beds. In terms of overflow wards, or a partnership, public-private sector partnership with the Andrews Memorial Hospital, we want to express our thanks to that institution for the 15-bed non-COVID facility that is established at that location, which will take some of the pressures off the regular hospital system in the corporate area so that we can dedicate more time to COVID support should we need it.
On the matter of personnel,
so we have increased hiring of staff in the Southeast Regional Health Authority and the Western Regional Health Authority, which have the main Type A hospitals. In the Western Regional Health Authority, which consists of St. James, Trelawney, Hanover, and Westmoreland, 18 additional temporary doctors have been approved, with 6 receiving contracts to start tomorrow morning. 42 nurses, assistant nurses, and patient care assistants are being hired, with some 14 being interviewed tomorrow, Monday, March 1st. In the Southeast Regional Health Authority, that consists of Kingston, St. Andrew, St. Thomas, and St. Catherine, 43 additional temporary doctors have been approved, with 4 receiving contracts to start tomorrow, and 236 nurses, assistant nurses, and patient care assistants are being hired, with contracts being finalized for deployment within the next 2 weeks.
Prime Minister Andrew Holness, in addressing the matter, urged Jamaicans to be vigilant.
If you have to go out on the buses, in the market, walking on the road, try to avoid a crowd. If you are going anywhere and you see more than 10 persons, as I like to say, take care of yourself.
The St. Thomas Health Services received much-needed tents and sundry items from the Centers for Disease Control and Prevention Caribbean Regional Office, United States Embassy, recently. The handover ceremony took place at the Princess Margaret Hospital on February 26. Medical Officer of Health for the parish of St. Thomas, Dr. O'Diane Smith, says the tent and medical equipment allows greater spacing, better social distancing, and the overall management of COVID-19 within the parish. Acting Parish Manager for the St. Thomas Health Services, Mrs. Pauline Ellington, says the tents are in use in 3 health facilities: Morant Bay Health Center, Seaforth Health Center, and the surgical clinic at Princess Margaret Hospital. Buoyed by global vaccination programs, global oil prices rose on Monday. We get this and other details in this quick business report with Gabriel Thompson.
In Friday's trading session, the JSE combined index advanced by 1,962 points to close at under 400,000 units. Overall market activity resulted from trading in 89 stocks, of which 42 advanced, 34 declined, and 13 traded firm. The junior market index advanced by 0.87 points to close at under 3,000 units. Stocks advanced for Access Financial Services Limited, Barita Investments Limited, and Berger Paints Jamaica Limited. Stocks declined for 138 Student Living Jamaica, 1834 Investments Limited, and AMG Packaging and Paper Company. Trading firm were 138 Student Living Variable Preference Blue Power Group Limited and CAC 2000 9.5% preference shares. Wigton Wind Farm Limited ordinary shares was the volume leader with 22.5 million units, followed by G West Corporation Limited ordinary shares with 13.5 million units, and Indies Farmer Jamaica Limited ordinary shares with 5.9 million units. Now for the foreign exchange. The US dollar on Friday, February 26, ended trading at $151.94. The Canadian dollar sold for an average $120.39. The pound sterling traded for $210.65, and the euro ended trading at $186.57. Oil prices rose more than 1% on Monday, supported by optimism over COVID-19 vaccinations, a U.S. stimulus package, and growing factory activity in Europe despite restrictions imposed to curb the coronavirus. Both contracts finished February 18% higher. Brent crude futures rose $1.08 to $65.50 a barrel. West Texas Intermediate crude futures jumped $1.04 to $62.54 a barrel. And that does it for the Monday edition of the Business Report on PBCJ. I'm Gabrielle Thompson.
Over now to regional news. According to the Director of Infectious Disease Prevention Program in the Bahamas, 2021 should be a much better year for the country in the fight against COVID-19. We hear more in this report.
In just a few weeks, the country will mark 1 year since the first positive case was confirmed. Forbes said with doses of the vaccine expected shortly and more advances made in the fight, this year is shaping up to be better than last.
Overall, we can be optimistic that this year should be better than last year, all things considered. So we have several vaccine candidates that all do just about the same thing. They stop people from getting COVID, they prevent people from getting sick with COVID, and they stop people from getting hospitalized and getting seriously sick and dying. So that is a good thing.
Though health officials have been monitoring isolated spikes in several workplaces on New Providence and Abaco, Forbes says the Ministry of Health acted fast and appears to have it under control. When it comes to the easing of restrictions, Forbes says worldwide trends have shown an easing once vaccinations become available.
We've already seen countries that are rolling out the vaccine. They've made some changes in what freedoms could be allowed if one gets a vaccination. So in Europe, for example, you could maybe have face-to-face gatherings again. You could enjoy, say, going to gyms and other activities. That's once you're vaccinated, the CDC has come out and said that if you are vaccinated and you are identified as a contact of somebody who has COVID, maybe you wouldn't need to quarantine and so on. And so it should look more hopeful because the vaccine should allow protection, but vaccinations rather should allow protections, and people need to get vaccinated to get to that point. It takes a certain tipping point. You have to vaccinate a large majority of the population, at least 70%.
In the meantime, Forbes says Bahamians must continue to follow safety precautions so progress can continue to be made. The Center for Disease Control in the U.S. has recommended double masking in some cases. Forbes has asked whether Bahamians should follow that same advice.
It comes down to your mask quality. For certain basic fundamental principles, your mask should be fitting snugly, but not so tight that you can't breathe through it. Layered fabric is helpful. And so double masking can help to filter more particles. So that's essentially what it is. If you wear a cloth mask, you could wear a surgical mask under that, or 2 layers of cloth masks. That's very important. There are some important guidelines about not double masking. If you're having a KN95 mask, you probably shouldn't double mask because it could affect the fit and the breathability. And then, of course, if it obstructs your vision and if you can't breathe, that's not recommended. But sure, if you're using cloth mask and the like, double masking can help.
In Barbados, the president of the Democratic Labour Party is expressing concerns about the government's proposed National Vaccine Fund. More from Barbados today.
During a national address last week, Prime Minister Mia Mottley announced the pending launch of the fund to which Barbadians will be asked to donate to help cover the cost of vaccines. However, speaking on the DLP's virtual program last night on the topic, The Two Sides of COVID in Barbados, DPZ argued that now was not the time to introduce anything new, as quite a significant number of Barbadians were in dire financial straits due to the COVID-19 pandemic. She suggested other ways the vaccine purchase could be funded.
We came up with 6. There could be more, but we came up with 6. First of all, going on the central bank report, the foreign reserves leave space for us in terms, even though that is borrowed funds, we still have a gap of about $80 million to still meet that 1% surplus that the government is seeking to achieve under the revised IMF program. So there is a source of funds that can be used. We have also the BEST program, which is significantly undersubscribed to the extent that $300 million that was set aside for tourism-related businesses to capitalize themselves and improve during the COVID struggles remains unused. Some of those funds, not all, but some of those funds could be repurposed to pay for the vaccines. We also have, in terms of the reserves, we were told that we had 35 weeks of coverage for our reserves. That is way ahead of the international standard for reserves. So again, we have some space. Those are 3 so far.
DPZ also made reference to the garbage and sewage levy.
Truthfully, nobody knows yet how much money the garbage and sewage levy has brought in, because those are funds that should be reported by Barbados Water Authority as the collection agency, but we haven't seen any financial statements for any of the relevant periods. But if we had an accounting of that levy, maybe, just maybe, we will find that there are some funds in that levy that could also be put towards the vaccine. It would call for some legislative change, but let's face it, they have the majority in Parliament that they can make that legislative change and effect the transfer of funds which are not in the consolidated fund, but are funds that belong to the people of Barbados and can be put to use for the people of Barbados. And then, of course, we heard last year about the COVID-19 Relief and Recovery Barbados, Inc., a company that was set up to source funding from out of the diaspora. We have never had a reporting in relation to that company either. So we need to know what funds are in there, whether any is available for vaccines. And then, of course, the bloated cabinet and all of the consultants.
In sports, we look to football. There is still no announcement for kickoff of the 2021 Premier League. However, with the island in the middle of a COVID-19 spike, any announcement would more than likely come later rather than sooner. The issue was addressed by Prime Minister Andrew Holness at a virtual press brief on Sunday. Melvin Pennant picks up that story.
The pandemic has left the National Premier League start date in limbo. To date, Professional Football Jamaica, who are the organizers behind the league, have garnered multiple sponsors but not yet been given the green light by the government to proceed. Prime Minister Andrew Holness said no start could be considered now given the current COVID-19 spike.
Recently there was an issue about how the orders were administered. And it raised the favoritism, equity issues, and we look very carefully at it. We would like to see the resumption of sporting activities, no doubt, but we want to see it done safely. What we're observing is that the various sporting associations, they are coming on board with plans and they're working on it. But right at this point in time, it would be inconsistent with the challenges that we face if we were to give approval. So whilst we are not closing the window on sports, but just within this period until we get a leveling off of the threat, we would not be able to give approvals. So we would still consider them, still work with them to ensure that we refine the arrangements. And then as soon as we are out of this danger zone, we can start to look at how we can get the sporting sector back up and running. And I want to thank the sporting sector for their patience and understanding. I know it's not easy.
Local Government Minister Desmond McKenzie says the administration will continue to work with key stakeholders to navigate through this difficult and uncertain period.
All I can say for now is that the matter will be reviewed and looked at to look at what is possible. I want everyone to understand and appreciate the circumstances under which we are operating now. And we will take it based on the discussions that we'll be having over the next couple of days involving the Minister of Sports and the Ministry of Health on this matter. But I want to make the point that we did, in fact, made allowances for the resumption of training earlier on. So we'll have to revisit based on the existing circumstances.
Melvin Pennant, PBCJ News.
And that's our package. On behalf of our entire production team, we wish you pleasant viewing and keep safe.